The CDC unveiled new mask guidance today for fully vaccinated Americans.
You can now ditch the mask for many outdoor activities, except crowded events like concerts or sporting events. But wearing a mask in public spaces indoors remains a must.
Lots to talk about at our weekly visit with UW Health's Chief Quality Officer, Dr. Jeff Potoff. Good to see you again, Doctor.
Hi, Dr. Potoff. Good to see you.
Good to see both of you.
So outside, vaccinated people don't need to wear masks. Do unvaccinated people need masks?
Yeah, I would recommend that unvaccinated people still wear that mask just because their risk of getting the disease is higher and their risk of transmitting the disease is higher. So if you're unvaccinated and you're outside in a group of people, still wear that mask. But if you're fully vaccinated, that mask requirement goes away. I think the only caveat is as you add more people to the group, including those who are unvaccinated, I think, concerts are a good example, then you're going to wear that mask even if you are vaccinated.
So basically what this is telling us is that outdoors is always safer, that the virus has trouble transmitting outside. Is that right?
Absolutely. The volume of air outside makes it nearly impossible for the virus to accumulate at high levels. So it does really require close contact with someone who has the disease to get infected outdoors versus indoors where that air isn't really moving. You could be a ways away from someone with COVID-19, but if you're in that space long enough virus particles could accumulate where you could get infected.
But if you're unvaccinated and just walking down the street with your dog or something, you don't need to necessarily wear a mask.
Right, because there's this idea that you need to have a certain amount of contact time with someone who might have COVID-19. So if you're just walking or running down the street and you pass by someone else, that half second of contact is not going to be enough to get you infected. You're going to have to stop and talk to that person for a little bit to increase your risk of getting infected if you're unvaccinated.
There is still an issue with vaccine hesitancy, and more people are now getting their second shot than are getting their first shot. So things are sort of going in the wrong direction in some ways. What does that mean, and is that going to have some implications for herd immunity down the road?
It could have implications for herd immunity. We really want 70–80% of people to be vaccinated. We can't yet vaccinate our kids, so they're at risk. So we'll need more adults to get vaccinated. I think there's some people who, no matter what you say, have made up their mind they're not going to get vaccinated no matter what the science is. But I think there's others who are just looking and they want really good evidence that this is a safe and effective vaccine. And to them, I'd say it's out there. We have hundreds of millions of people who are vaccinated. The vaccines are safe. Adverse events, especially those severe ones, really small incidents. And when you put on a scale getting COVID-19 and taking your chances with that disease versus, a day or two of side effects from a vaccine and then you're protected, it's an easy decision. We got to roll up our arms, get those shots.
But what do you say to those people who say, no, I'm not going to get one?
Yeah, I think, we try to engage with them and understand their reasons because oftentimes they may have read something or they believe something that actually isn't true. Maybe they picked it up on the internet, and we'd encourage them to talk with medical professionals, experts, to really understand what is their concern and how can we show them, the actual data, the truth behind whatever it is that they think makes a vaccine a bad choice for them.
Vaccines, the amount of vaccines given out at the Alliance Center is nearly half this week from what it was last week. And a lot of people, millions of people, are not getting their second shot. So what risk are people taking if they don't get their second shot?
There is some risk with not getting that second shot. Now, we know that even after the first shot of Moderna or Pfizer, 10 to 14 days later, you will have some immunity. So it's better than nothing. But, if it was really great, we wouldn't have a second shot. It'd be a whole lot easier for all of us if it was only a one-shot series. So that should say something to those folks to have them think, if we have to give second shots and we're taking on all this extra work to make this a 2-dose series, it's probably in your best interest to get that second shot. Now, if you missed it and you have a change of heart and you want to get it, that's okay. Getting that second shot a little bit later, maybe not as good as getting it on time, but it's still okay to get that second shot later if you missed it the first time.
Well, it's good to hear.
And the J&J is back at the Alliant Energy Center, so that's a one-shot deal.
Yeah, and I think for a lot of people, that's a really desirable option. A lot of people have really tough work schedules. Maybe they're trying to balance family, and the idea that they have to get time off to go get 2 shots, that's really hard. So having just one shot is great. Plus, there's a lot of people who just don't like needles for whatever reason. Having to only do it once is a much better option for them than having to do it twice.
All right, get those shots in. That is the key to getting back to normal. Doctor, thanks for being with us again. We'll see you next week.
Great to see you, Dr. Potoff. Appreciate your time.
See you next week.